So it's time for the explosion of digital health tools. And the term explosion is not one that I chose thinking about D-Day, but I guess it could have been. So the reason for this topic is the fact that I believe that you, if you're interested in digital health, have probably been as inundated with data about digital health in the past year as I. And while you may have your own projects, you're wondering, how does this make sense? So at this time of the day, it's my hope or my goal to give you an overview of this digital health explosion and trying to tie it into the history of Doctors 2.0 as well. And it was here in our 2011 first version, the iPad had come out not so long before that we felt that this iPad tablet was going to change the course of history. And quickly, with the shadow of Steve Jobs over us, the numbers did show that the iPad was crashing down on what had been already successful launches, but it was the biggest launch from the Apple company. And in particular, we were all laughing about the fact that the manufacturers came right out with these white coats with pockets for the doctors, but that was a symbol of the fact that the doctors were going to be massively interested in this. And sure enough, the tablets came over the past couple of years to bring in a very interesting amount of sales. And we're now speaking of things that are in the millions and billions. And from those billions, there were so many ideas as well. We mentioned here how the basic partnership between the patient and the physician is what makes this conference, this Doctors 2.0 and you. And the IBG star on the left owes its origins to a letter from a patient in the United States to Steve Jobs, suggesting that there be a medical accessory that could be added to the iPhone so that there would be closer to a one-stop operation for people with diabetes. That's Amy Tendrick, that many of you may know from social media. And on the right, it's a physician in Oklahoma, a state that most people don't get to visit necessarily, who imagined that there could be a portable electrocardiogram. And I know that some of you in the audience have even purchased this just to show or maybe to use, because now it can be purchased by anyone, even though originally it was prescription only. And we showed last year the transition to connected objects that has been so much more present this year with the Why Things Scale, the high blood pressure measurement. We showed also the first digital fork. All of these were created by French companies. We also showed the next step after that there was something called Google Glass that could be of interest in medicine and surgery. And while you may not recognize all of the people on the right-hand side, they're actually here in the room, and you will be seeing them later. You can try and guess who they were. And so now the chart keeps getting new layers. That's why it's so confusing to understand where we're going. We began with the personal computer being connected. We went on to smartphones and tablets, and now we're into really the third generation of the internet. People are calling this 3.0, but it gets a bit confusing to have all these generations running around. So it's the Internet of Things, which is the fact that we can connect any object, because the object itself doesn't have to be programmed. If it gets a sensor on it, your body becomes an object, as well as smart TVs and the wearables. And so now we're in the billions, up to maybe 20 billion objects, which is approximately 3 times as many people as there are on Earth. And so all of that is generating a huge amount of data. This is the way somebody imagined to present big data, with information from the Census Bureau, for example, being the dark blue on the left. You can see how tiny it is. That huge purple one on the upper left is business email. And I'm going to zero in on that dot, which were all the tweets in 2012. So you can see that big data is absolutely gigantic, as its name would infer, but it is a real truth. And so there's a venture capitalist who decided that he would show what the ecosystem of big data looks like. And I'd say that's a big chart. This Matt Turk, who's also contactable on Twitter from First Mark Capital, put this together, all the companies working on the infrastructure of big data. So you can see that I'm taking you along. We started with the smartphone, we went to the iPad, we spoke about some of the applications. We're into big data. I'm taking you along, and here are connected objects, for example, for running and fitness, because I want to insist on the fact that healthcare doesn't march to a separate drum. Healthcare is part of the world of innovation. So many people in healthcare say, but it's different from the others. Healthcare cannot go faster than the rest. If the rest of this infrastructure didn't exist, then these healthcare innovators could not happen. And because it does, they do. And so here, for example, is somebody who positioned all the different areas that can turn into the Internet of Objects. And you can see on the left-hand side, smart pills, personal medical monitors. You can see that cars are much bigger for the moment, but it shows you that we're all moving forward in every single area to the day where absolutely everything is connected. And so that is the question. In the head of this image that you see rotating, where is digital health headed? Because you might say, well, that's fine. We understood. We knew as much as you about where this is all going, because this is all one big peer audience. I have to say first that it's going towards a new integration. And I'm going to show you a few seconds of something where I will comment on why I consider this. Able to record it
and send it to anyone you want.
So you missed the beginning of the video. Do you know what that was? That was a pregnant woman listening to the heartbeat with Bella Beat, which is a very new company. Why do I call that integration? Because, not just because the baby is integrated into the mother by Mother Nature, but because that woman has a fully integrated system. She can watch how her pregnancy is developing compared to general rules. She can look at all of her activity. She can watch the baby's activity. She can send it to whomever she wants, whether it's just an individual or a healthcare professional. So it's not just one app over here and one app over there. It's a multiple app system. And here's another example, which is Cepher BioPatch, a wireless device that only weighs something less than 1 ounce, so a few grams, that can be placed on the body. And if you can imagine, as I would of people who are no longer with us in my family who had cardio problems, how incredibly reassuring it would be to have this on and to be able to be assured that your physician would be aware or your healthcare system would be aware if there were an issue. And it's connected to a hub so that you can add all devices about this. I'm sure that Uwe Diegel will speak about this, that we're going towards a world where everything is connected, integrated, fits together. All of these devices are beginning to speak to one another. That is the goal. It's not going to be like with electronic health records where the HL7 and other standards are still hoping to get everybody together. So integration in this digital health explosion is very important. And yet another example that I picked up on Indiegogo, which is a crowd sourcing system. Indiegogo is seeking money for this project called InstaMD. You know, we've talked a lot about telemedicine in the past. This is really amazing because this patient can take any stethoscope, be sitting there, and having the sounds that he is generating from his body sent immediately to a distant healthcare professional. It is exactly, to this degree, the same as being in the office. And a further example of integration, which I find really fabulous, two guys had the idea that they could turn biology into electricity. that they could take substances from our body, and instead of your having to go to a lab, the lab is in the box, and the box is in your pocket practically. So they will turn these, for your saliva or anything else, into electronic impulses, which with Bluetooth will enable you to send the information and immediately know what the numbers are from a biological standpoint. So you can see the incredible disruption that will come from this, what I'm calling new integration. And there's not just new integration in all of these individual areas, but for people who are interested in prevention for their own health. Here's the eye health tracker that has so many different things, and with a company as this one, will go further and further to bridging the gap between prevention and medicine, because they have both parts of it, so very integrated. And all of that means new investments. New investments are so important, and Rock Health Company, which follows primarily American investments, noted that new investment is up 87% in the first quarter. So this explosion of digital health tools is bringing a lot of money with it. The problem is that while many of you are involved in operations where you only look at things from one disease area, you might say, well, I'm a cardio this, or I'm interested in cancer. This is creating new cross-cutting segments. That's the other idea that I wanted to bring to you. That is not only integration, but that we're looking at new segments, because new companies are cutting up the field in a different way. It might be healthcare. I'm coming to an investor and saying, I want money for healthcare consumer engagement, or I want money for care coordination. They're not saying rheumatology, cardiology. New kinds of segments driven by digital health. Here's one where, for the American Association of Retired People, just for the baby boomer area, they said there are going to be 9 areas where, or there are 9 areas where companies are presenting new services, managing medication, falling emergency detection, for example, personal fitness. Who would have thought you could be a product manager for navigating the healthcare system? Those are all those sites that recommend where you could go, give you opinions about it. And what does that mean? That means that there are plenty of new players. So it's not just some of the traditional healthcare companies, it's other companies. In artificial intelligence, who hasn't heard now of IBM Watson and what IBM Watson has developed in cancer? There's Microsoft, Facebook, Apple, and Google, and we're going to come back with them. You know that Google has bought up all the great artificial intelligence companies. People who now want to get into artificial intelligence have to start from scratch or become a partner of Google. And many of you saw that Google had this smart contact lens for the purpose of measuring glycemia through the fluids accessible from the eye. And that's not all that Google is doing. I don't know if you realize that that company called Calico stands for California Life Company. Sergey Brin and Larry Page, nothing less than conquering death and bringing to it the chairman of Genentech and Apple, Arthur Levinson, with all of his business expertise. So they're very serious about Calico. Facebook, and I'm not going to just talk about the fact that you can do so much health activity on Facebook, because you know that. I'm talking about the little spending spree of $3 billion by Mark Zuckerberg for his 30th birthday, where he bought himself Oculus. Just imagine that you would be there with your physician in this 3D surround goggle type product that is now belonging to Facebook. And Apple, it's impossible to keep up with all the Apple rumors and realities. We saw this week, Apple is partnering with the Mayo Clinic for its new product called Health Kit, which is a fully integrated approach with combining quantified self and all sorts of other things. And Samsung, another hardware manufacturer. Samsung, I'm sure that many of you have noted that Samsung's Galaxy S5 was going to be reading stress levels, and then this week, they came out with Voice of the Body, talking about all the data that your body can produce. I had explained about Solo Glomo Gabi, which is social, local, global, mobile, and gaming and big data already a couple of years ago to this audience. Gaming is so important. We'll be speaking about it later, because if you don't change people's behavior, then they're not going to do all of this even at the beginning, and certainly not in the long run. We talk about how much big data is generated by it, and today I'm adding CO, sologlomogabiko, for connected or convergence. Yes, you have to say that 3 times fast. And we have in the audience Sylvie Royan-Parola, who, being in honor of American and French friendship today, I took a French example, Respiradom or Respiradom, where she has built, based upon that mask that people wear for sleep apnea and how uncomfortable that is for people to get started. It's reimbursed, it's telemedicine. There's a data record for patients and physicians to share with patient-generated data as well as machine-generated data. She's added a forum, and she's added a serious game, because she told me there's nothing like that serious game to explain to people in a good way what's going on. So Respiradom, to me, is the height of integration. And where are we going? Well, we're not going anywhere without the patient. Nothing about me without me. This is a patient-inclusive conference. And so I would like to ask now anybody in the audience who's a patient or a family related to stand up and get a big applause. These are the 27 speakers that have helped us over the past 4 years make it through the conference. They're all patients. Please stand up. Thank you very much.